Hello viewers, I am Dr. Arathi aithal and I am a breast surgeon from Shivamogga. Today I will be talking on common breast problems and how to deal with them effectively. Uh, to begin with, I will talk a few lines about breast anatomy. Breasts are mammary glands, that is milk producing glands, which are a characteristic feature of all female mammals. They are rudimentary in males. In females, however, they start growing in size and develop well only after puberty. Breast development occurs in various stages in a woman's life. It occurs even before birth, at puberty, and during the childbearing years. Within the breast are located mainly the milk producing glands that they are depicted as red lobe-like structures, and connected to them are pipe-like structures, what we call ducts, and these ducts carry milk from the milk-producing glands and they converge at the nipple. Apart from this, we have what is called as adipose tissue or fatty tissue, which is interspersed between the glands and the ducts. A dark circular area surrounding the nipple is called the areola. The whole breast sits on the chest wall over the pectoral muscles. So this slide depicts the cross section of the breast. Now coming to the breast problems. Breastfeeding problems form a major chunk of the problems in, in women of the childbearing age. Breast lumps, breast pain, and nipple discharge are also common in women of all ages, from adolescents to older women. While it can be frightening to discover a lump in the breast, the heartening fact is that most lumps are not cancerous. Breast lump. This is the problem which many women face. Although most breast lumps in women aged between 20 to 50 years are not cancerous, any lump in the breast should be evaluated by a doctor. The best test for evaluating a breast lump depends in part upon your age. For women under 30 years, if you have accidentally found a lump before your menstrual period, you may be advised to have a repeat breast examination after your period has ended. Because in this age group, breast lumps are often caused by hormonal changes and will resolve after your menstruation ends. However, if the lump persists even after the periods are over, then it needs to be further investigated. Lumps in women more than 30 years. In this age group, all breast lumps need to be investigated in detail. The doctor may also order an ultrasound scan, a mammography, and a needle biopsy of the lump, depending on the presentation. Now, coming to breast pain. The most common type of breast pain is caused by the hormones that control the menstrual period. These hormonal changes can cause pain in both breasts, which begins several days before the menstrual period and usually subsides within a day or two of her cycles. As the pain appears and disappears in relation to the menstrual cycle, it is called cyclical breast pain. This is a normal occurrence. Only if the pain is associated with a breast lump, then the lady needs to see her doctor. Less commonly, a woman can have breast pain that is not related to the menstrual cycle and might occur in only one breast or one area of the breast. This is not cyclical breast pain and is usually caused by a problem outside the breast. It may be muscular pain, or because of heartburn, or maybe related to spinal problems, or it may be pain related to the heart, or very rarely due to breast cancer. Nipple discharge. Having a milk colored discharge from both the nipples is common, especially during the first year or two after giving birth. Many women can express a small amount of yellowish, greenish, or brownish discharge. This is often a normal physiological discharge and is not a cause for concern. Spontaneous nipple discharge, or nipple discharge that's clear or bloody, may be caused by an abnormal growth within the breast, or less commonly by breast cancer. So the dictum is any woman with a nipple discharge should be evaluated by a healthcare provider. The other problem which many women face is inverted nipples. Many women are born with nipples that are naturally inverted at times. By inverted, I mean pulled in and pulled out at other times. Nipple inversion of this type is not a cause for concern. However, if your nipples have always been everted and begin to invert for no obvious reason, this should be evaluated by your doctor. Skin changes over the breast. Skin problems can develop on or near the breast, some of which can cause itching, scaling, or crusting, and sometimes dimpling, swelling, or redness, or a change in the skin color. Any of these can be seen. While most of these changes are not caused by a serious breast problem, it is important to be evaluated if a skin problem on your breast does not resolve within a few days. So, when should we seek help? Although breast problems are not usually an emergency, delaying the evaluation for months can potentially allow the problem to worsen. So, if you find a new breast problem, then you should take an appointment with your doctor. Now, coming to the breastfeeding problems. Breastfeeding is universally recognized as the best way to feed an infant because, in addition to being a nourishing food for the baby, it protects the mother and the infant from a variety of health problems. Even then, many women who start breastfeeding stop before the recommended minimum of exclusive breastfeeding of 6 months. There are various reasons for this. The most common reason for women to stop feeding is that they think their infant is not getting enough milk. The most common reasons infants have trouble getting enough milk are: the first and foremost, when they are not fed frequently, say once in 2.5 to 3 hours, which can cause the milk production to slow or even stop. The second reason is when the infant cannot latch on properly. So this is a slide which depicts the latching of a baby to the breast. By latching, I mean the baby holds the nipple properly in its mouth. When there is proper latching, the mouth of the infant is wide open as shown in the slide, and A bigger portion of the areola, that is a large portion of the areola, which is the dark circle surrounding the nipple, should be inside the mouth of the baby, and the chin of the baby is touching the mother's breast. So when these conditions are fulfilled, we say that there is good latching. Another reason where infants have trouble getting enough milk is when they are separated from their mother for long periods, either because the mother or the child is unwell or the mother is a working woman. When the children are formula fed in addition to breastfeeding, there are chances that the infant has trouble getting enough milk. Here are simple guidelines to the mother to know whether her milk is adequate. During the first week of life, mothers with term infants generally nurse 8 to 12 times per day. By the end of 4 weeks after delivery, nursing usually decreases to 7 to 9 times per day. By the 5th day of life, infants who are getting enough milk urinate 6 to 8 times a day and have 3 or more stools per day. Once the milk is sufficient, the infant's stool should be pale yellow and semi-solid in consistency. Term infants lose an average of 7% of their birth weight in the first 3 to 5 days of life. They typically get back to their birth weight within 1 or 2 weeks. Once the breast milk is sufficient, the infant should not keep losing weight. So, if your baby has a good latch, but you still have problems with inadequate milk, your doctor might suggest that you try to feed more often or try to stimulate milk production using medicines. So this is a slide which is showing a good latching of the baby. As I told earlier, the mouth of the baby is wide open. A large portion of the areola is inside the mouth of the baby, and the chin of the baby touches the breast. This slide shows the various positions that the mother can adopt to feed her baby. In the first 3 pictures in this slide, the mother is feeding her baby in a sitting position. And the last picture shows the mother feeding the child when she is lying on the bed. A good position is also very important for the child to be fed properly. The other important breast problem is nipple and breast pain. And pain is the second commonest reason why mothers stop breastfeeding early. Pain may be because of nipple injury, which can be caused by the baby which is not latching well, or even by a breast pump. Breast engorgement is also another reason for the pain, and breast engorgement means the breasts get overfilled with milk. The third reason is blocked ducts, and the last one, and also the most important one, is nipple and breast infections. Nipple injury usually is due to incorrect breastfeeding technique, particularly a poor position or latch on, and hence the mother cannot empty the breast. This in turn can lead to engorgement, blocked ducts, and subsequently breast infection. So, what should the mother do? First of all, she should learn how to position her baby so that the baby can latch on properly. Do not use harsh soaps or cleansers on your breast. If your baby is biting you, position the baby such that his or her mouth is wide open during the feeds. Also, stick your finger between your nipple and the baby's mouth anytime he or she bites. Always start nursing with a breast that does not have danger. Take paracetamol tablets. If nipple pain prevents the baby from emptying your breast, try using a breast pump or manually express milk to empty your breast. Coming to breast engorgement. Engorgement is the medical term for the condition when the breast gets fully filled with milk. If the engorgement makes it hard for the baby to latch on, then manually express a small amount of milk before each feed to soften the breast and make it easier for the baby to latch on. You can also use a breast pump to help soften your breast before a feed. Use warm compresses or even take a warm shower and then manually massage your breast from the periphery of the breast towards the nipple or in the opposite direction to clear the block. You can even take paracetamol tablets. If the engorgement does not get better within 1 or 2 days, then see the doctor at the earliest. This is a slide which is showing the manual expression of milk, wherein uh, we move from the periphery of the breast towards the nipple and express the milk out. Breast infections. This is also another cause of breast pain, which can make a mother stop feeding her baby. This is associated with fever and chills, breast pain, and redness over the breast. If you are unable to breastfeed due to any reason, be it engorgement, pain, or difficulty latching your infant, or the presence of an infection, seek the help of a doctor immediately because any delay in seeing the doctor can make the breast a bag of pus and loss of valuable breast milk for the baby. Now, coming to another important topic in the breast is breast awareness. Breast awareness simply means being familiar with your breast. When you are breast aware, you will be more alert to any unusual or abnormal changes developing in the breast. Early detection of these changes and subsequent treatments mean that your chances of surviving the disease are greatly improved. Hence, it's important to be breast aware because breast cancer is the most common form of cancer among women the world over. The risk of developing breast cancer increases with age, but it's important to be breast aware no matter how old you are. Examining your breasts takes around 5 to 10 minutes and can be easily incorporated in your daily routine. Self breast examination is a simple method which is both quick and easy and can be easily practiced. Self-breast examination is a way by which you can check your breast for any changes like lumps or thickenings that may signal breast cancer. When breast cancer is detected in its early stages, your chances of surviving the disease are greatly improved. While 80% of the breast lumps are not cancerous, you can detect potentially serious changes in the breast early by regularly doing a self-breast examination. Then how often should I do a self-breast exam? It's good to start doing this in your early 20s. You should examine your breast once a month, ideally 3 to 5 days after your menstrual period ends. If you have stopped menstruating, then do the examination on the same day of each month, as it is easy to remember. With each examination, you will become familiar with the contours and the feel of your breast and will be more alert to changes. This examination is done in 2 steps. The first is a visual inspection of the breast, and the second is examining the breast with fingers or palpating the breast. To proceed, undress up to the waist and stand in front of the mirror with hands on your hips. Now, what do you look for? Whether both the breasts are at the same level. Are both the nipples at the same level? Can you see any change in the color or an abnormal fullness in any part of the breast? Is the nipple everted? Is there any puckering of the skin? Is there any discharge from the nipple? So on. These are all the things that you have to look for. In the second step, the lady has to lift her arms above her shoulders. By doing this, certain regions that were obscure when she was keeping her hands on the hips will become clear, and you can even see those areas with clarity, like the armpit and the lower half of the breast. You also have to see if there are any changes in the nipple when she lifts her arms above her shoulders. Now, these are some of the changes that you observe, like changes in the skin texture, discharge from the nipple, any atypical fullness or puckering or retraction of the nipple. So far, we saw the slide about the visual inspection of the breast. Now, coming to the second step, that is examining the breast with the help of the fingers. This test can be done either when the lady is standing or when she is lying on the bed. When she is examining her breast, the corresponding arm should be lifted above the level of her shoulders. For example, like in this slide where the lady is examining her right breast, her right arm is above the level of her shoulders. It's placed under the head, and she's examining the right breast using her opposite hand, and this is for the sake of convenience. Using the pads of your fingers, press firmly on your breast, checking the entire breast and armpit area. The breast can be examined either using the circular or the up and down pattern and even the wedge pattern. This slide shows examination of the breast in the lying down position. To examine the right breast, place a pillow under your right shoulder and place your right hand behind your head. Using the pads of your fingers, press firmly, checking the entire breast and the armpit. Repeat the same on your left breast. See, this slide shows the pads of the fingers which are at the tips. In the end, gently squeeze the nipple of each breast and see if there is any discharge. If there is a discharge, this has to be reported to a doctor immediately. In conclusion, an important advice to a lady who has accidentally detected a breast lump. Do not be shy and do not delay your visit to the doctor. Do not take your own decisions, nor the suggestions of your neighbors in coming to a conclusion about the lump. The lump may be painless or painful. In both the cases, the surgeon's opinion is mandatory. Last but not the least, do not panic. 80 to 90% of breast lumps are not cancerous. And even if they are, there are very promising treatment options available, provided you see the doctor at the earliest. Losing the breast as a treatment option is a thing of the past. Breast conservation is the new norm. With this, I conclude my talk. Thank you.